All right, so let's discuss more about presenting complaint. Whenever patient comes to us, definitely he or she will be having some complaint. That's why they are in the clinic. That's why they are in the hospital. So usually you will see the presenting complaint might be pain or might be something else, right? So if we have got pain as the presenting complaint, we have got Socrates. We have got this Socrates. Site, onset, character, radiation, associated symptoms, time, exacerbating and relieving factors, and severity. So meaning this is a rough mnemonic that you can remember for pain, right? And if patient presenting complaint is not pain, it might be dizziness, it might be cough, it might be shortness of breath, then the mnemonic we use is Odipara. So these are two mnemonics, very, very important. Pain is Socrates. Other than pain, if it is dizziness, cough, shortness of breath, it is Odipara. And there are a few things. For example, patient had got fits, patient has got fall, patient has got vertigo, patient has got dizziness. Dizziness, you can use Odipara, but also one more thing we have to do. We have to ask before, we have to ask during, we have to ask after. For example, it's fit. We ask what happened before the fit, what happened during the fit, and what happened after the fit. So that kind of history we have to take when we are dealing with the case of fit, fall, vertigo, dizziness. Right, so this is the way how you do presenting complaint. Pain is Socrates, other than pain is Odipara. Right, so let's discuss it in a bit more detail about these things. What is this Socrates? So Socrates is a mnemonic for pain. Worldwide we use this mnemonic. It's site, onset, character, radiation, associated symptoms, time, exacerbating and relieving factors, and the severity of the pain. Everything is very important because that will be important, to narrow down your differential and to come up with a proper diagnosis. When you elaborate the presenting complaint properly, you will see it will be very easy for you. Let's see, every single thing is very important. For example, Scythe. It will give you lots of information. Could you please tell me where exactly is the pain? So sometimes patient is telling you, doctor, I've got pain in the back. So sometimes patient will tell you verbally, doctor, I've got pain here. Sometimes they will point out, doctor, I have got pain here, I have got pain here. So they will be pointing it to that particular area. But make sure when you are asking about site, you are having a perfect answer. For example, patient is telling you, doctor, I've got pain in my back. So confirm which part of the back, upper back, middle back, lower back, because your differential will be different. So that's very, very important to know, right? Where exactly is the pain? Right, so onset, whenever you have got onset, we have to do few things. How did this pain start? That is very important. If it was sudden, if it was gradual, that's very important. Sudden pain, if, for example, you got sudden headache, mostly it is going towards SH. Patient is saying, doctor, it's the worst pain of my life, I have got this worst headache. Suddenly it started. So we are thinking more towards SH. Sudden chest pain, like patient said, like I was working and suddenly I started having this chest pain going to my arm, to my jaw. So what is this? What is this? Actually, we are thinking about ACS. And patient might be having some gradual kind of pain. Doctor, I've got this joint pain, and gradually it is getting worse. I'm old, man. So arthritis we are thinking. Meaning onset of the pain, it is sudden, gradual, will give you lots of idea about your diagnosis and your differential. Always ask the patient what you were doing before when you experienced this pain. Maybe patient was doing something that has led to this kind of pain. Maybe patient was lifting heavy objects and that's why patient started having back pain. Doctor, I was working in a factory and I was moving heavy objects and suddenly I started having back pain. That is very, very important because you will find out at the same time, you will just get to know this is nothing other than disc prolapse. Because you'll see when patient is moving heavy object, there are chances that they might have back pain. That's because of disc prolapse. Yeah, right? So that's very important. Since when you are having this pain, that's very important. Ask the pain in the onset, like, is it continuous pain or is it intermittent pain? If the patient is saying it is continuous, ask, are you still in pain? If patient says, yeah, doctor, are you comfortable to talk? If not, you can offer painkillers as well. See if you can give painkillers in that question, in that particular scenario or not. All right. If you can, then ask the examiner, I would like to give painkillers to my patient after ruling out allergies and contraindication. And if you feel, no, I cannot give painkillers. Why? Because I have to examine this patient. So simply let me examine you first, let me assess you first, and then I'll give you painkillers. So that would be your approach. right? And if patient is saying I'm not in pain, then how long were you in pain? Meaning whatever positive you have got, make sure you go in detail of it, you elaborate it perfectly, right? Then we have got intermittent pain. Intermittent, like a patient says, doctor, pain comes and goes, so how many episodes did you had? How often you get these kind of episode, and when you got this pain, when you get this pain, how long the pain stays, right? So how many episodes you had, how often you get this pain, and whenever this pain comes, how long it stays. That is what you will ask if it is intermittent pain. I know, like, you might be thinking that too much stuff, but when you ask open question meaning tell me more about pain, tell me more about pain, you will see patient will tell you lot of things, and you will see like lots of things from this Socrates will be already done, right? So please make sure you don't miss anything when you elaborate the pain, when you elaborate Socrates. We have got character of the pain. Do you think it's important? Yes, it's really important to know the character of the pain. Could you please describe what kind of pain it is? Help the patient, like what kind of, sometimes patients will say, doctor, what do you mean? And then you can give some idea to the patient, like, do you feel it is squeezing, it's heavy, it's sharp, it is dull pain, right? Or you can ask simply, could you please describe what kind of pain you have? Sometimes patient will tell you, sometimes patient won't be able to describe the exact character. They will simply say, yeah, I don't know, doctor, it's simply painful. All right, meaning they don't want to give you that information, but that's fine. So for example, a patient is telling you, doctor, it is like heavy chest, I feel like it's a squeezing kind of pain, we are thinking about ACS. If patient is saying, it's sharp pain, doctor, we are thinking about pericarditis, we are thinking about pulmonary embolism. Patient said, doctor, I've got dull pain in my flank, we are thinking about pyelonephritis. Meaning the character of the pain, it's not the only thing. There are lots of things in Socrates, but character is very important. It will give you good information regarding the diagnosis. Patient is having chest pain. Doctor, I feel somebody is sitting on my chest. It's very heavy. We are thinking about MI. We are thinking about acute coronary syndrome. Right, radiation of the pain. That's really important. Radiation. Does the pain go anywhere? Any pain like chest pain going to the jaw, going to the left arm, that's very important. Typical ACS pain. So ask the patient, does the pain go anywhere? So shifting of the pain is very important. Radiation of the pain is very important. And also, you can ask when the pain started, where it was. Where was the pain when it started? For example, you want to rule out appendicitis. Appendicitis pain, what happens with appendicitis pain? Patient will be having pain in the umbilicus, and then it will shift to right iliac fossa. So if patient is presenting, you have got a patient is having pain in the right iliac fossa. So ask the patient, where was the pain when it started? Doctor, it was there only. It means you have almost ruled out appendicitis, because appendicitis pain starts from umbilicus and then it shifts to right iliac fossa. So every single question of Socrates will help you in narrowing down your differential. Time is very important. Time is really important. Like, does the pain follow any pattern? I mean, is there any time of the day? Like, patient is saying, doctor, I've got morning headache. If patient has got morning headache, morning vomiting, what we are thinking? We are thinking about SOL. We are thinking about space occupying lesion. So that's very important point. We have got exacerbating and relieving factors as well. Ask the patient if there is anything that makes the pain better. Is there anything that makes the pain worse? Ask it like one by one, because patient might tell you, yes, doctor, there is something like, patient has got chest pain. Doctor, if I'm bending forward, it helps me a bit. Pericarditis pain, it's typical. If bending forward relieves the pain. See, patient has got chest pain, which is getting relieved on bending forward. We are thinking more towards pericarditis. So ask question more towards pericarditis, right? But sometimes patient might say, doctor, yes, if I'm taking paracetamol, it gets better. Ask the patient, ask detailed history of that. Ask how many paracetamol did you take, when did you take, right? Because in the end you have to do the pain management as well. You need to know what patient has already taken, so that you can do a good pain management for the patient. So make sure you're not missing that. Is there anything that makes the pain better? Yes, doctor, I'm taking a paracetamol, it helps. How many paracetamol, when did you take? Right, that's very important. Ask the patient, is there anything that makes the pain worse? Maybe any activity, any kind of thing, anything that he eats, anything he does, that is making the pain worse. So we should have that finding. It will be very, very helpful in narrowing down our differential. Then we have got this severity. That's also very important. Could you please score the pain for me on 1 being the lowest and 10 being the highest? Could you please score the pain on a scale of 1 to 10? 1 is the lowest and 10 is the worst pain you have ever experienced. Could you please score the pain on a scale of 0 to 10? 0 is no pain, 10 is the worst pain. The thing is, what you need to do, you need to give a scale to the patient for the pain, and then patient will be telling you accordingly, doctor, this is 5, this is 6, this is 7, 8. So accordingly it's very helpful, and accordingly you can do the pain management as well. If patient says 10 out of 10, do you think paracetamol will be helpful? No, you may have to give something stronger, right? So that's very important. That is what we have got in severity, right? So what we said, if your presenting complaint is pain, we are using Socrates. And if the presenting complaint is cough, if the presenting complaint is shortness of breath, we use Odipara. Odipara is onset, duration, intensity, progression, aggravating and relieving factors, and associated symptoms. Why this is different? Because, like for example, pain, you can score the pain on a scale of 1 to 10. You cannot score cough, isn't it? So that's why it's almost the same, but there's a few things which are different. So pain is Socrates, and cough, shortness of breath, you need to do it by the mnemonic Odipara. Onset, duration, intensity, progression, aggravating and relieving factors, and associated symptoms, right? Thank you.